Urodynamic study, an overview. A urodynamic study is a series of diagnostic tests used to evaluate the function of the bladder, urethra, and sphincters. It is typically performed to diagnose conditions that affect the lower urinary tract, such as urinary incontinence, frequent urination, or difficulty voiding. Purpose of urodynamic study: a UDS helps in understanding 1. Bladder function, how the bladder stores urine, the bladder's capacity and compliance, whether the bladder empties properly. 2. Urethral and sphincter function, whether the sphincters open and close correctly, urethral resistance during voiding. 3. Neurological control, if the communication between the bladder and the brain is functioning correctly. 4. Identify abnormalities, overactive bladder, OAB, stress or urge urinary incontinence, neurogenic bladder due to spinal cord injuries or neurological disorders. Indications for urodynamic study: urinary incontinence, stress, urge, or mixed incontinence; frequent urination, daytime or nighttime, nocturia; urinary retention, inability to empty the bladder fully; recurrent urinary tract infections, UTIs; neurological conditions, multiple sclerosis, Parkinson's disease, spinal cord injuries; pelvic organ prolapse, to assess its effect on bladder function; pre- and post-surgical evaluation, before and after procedures like prostate surgery or bladder surgery. Types of urodynamic tests. 1. Uroflowmetry measures the flow rate and volume of urine during urination, helps detect weak bladder muscles or obstruction. 2. Post-void residual PVR measurement determines how much urine is left in the bladder after voiding, typically done with an ultrasound or a catheter. 3. Cystometry cystometrogram evaluates bladder pressure as the bladder fills and empties, detects overactive bladder or impaired bladder compliance. 4. Pressure flow study measures bladder pressure and urine flow simultaneously during urination, helps identify obstructions or weak bladder contractions. 5. Electromyography, EMG, records electrical activity of the bladder and sphincter muscles, useful in diagnosing neurological problems. Or 6. Video urodynamics, combines cystometry and imaging, X-ray or ultrasound, to visualize bladder function. 7. Leak point pressure, LPP, measures the bladder pressure at which urine leakage occurs, useful for diagnosing stress incontinence. Procedure 1. Preparation. Patients may need to stop certain medications affecting bladder function, arrive with a full bladder, or empty the bladder as instructed. 2. During the test, a catheter is inserted into the bladder and sometimes the rectum to measure pressures. The bladder is filled with sterile fluid through the catheter. The patient may be asked to cough, bear down, or void during the test. 3. Post-test. Temporary discomfort or mild hematuria, blood in urine, is common. Patients are advised to drink plenty of water to reduce the risk of infection. Risks and side effects. Discomfort during catheter insertion or bladder filling. Infection, increased risk of urinary tract infection, UTI. Bleeding, mild blood in urine due to catheterization. Rare complications, severe pain or infection requiring treatment. Results interpretation. The results of a urodynamic study can provide detailed insights into bladder and sphincter function. Normal function, normal pressure, capacity, and emptying patterns. Abnormalities, overactive bladder, uncontrolled bladder contractions, obstruction, high bladder pressure with poor flow, weak bladder, low pressure with incomplete emptying. Conclusion. A urodynamic study is a valuable tool for diagnosing complex urinary disorders. While it involves some discomfort, it provides crucial information for creating an effective treatment plan tailored to the patient's needs. Consultation with a urologist ensures proper understanding and application of the findings.